Hello, friends. This is Amaze Live. I'm Christine Coe, and I'm here with the wonderful Dr. Hina Talib. How are you?
I'm well. How are you?
Oh my gosh, I'm so excited to talk to you. We've mostly talked on the internet, and now we're here, like sort of live. We are live, but face to face, which is just lovely. So thank you for taking the time out of your very busy schedule to join us today. This is so awesome.
Thank you for having me. I love parents, and I'm excited to be here.
Yes. And is it okay for me to call you by first name
Yes,
here?
it
Okay.
is.
Okay. All right. So, Hina, I was wondering, as people are starting to join us on the broadcast, if you could start by telling us a little bit about yourself, especially because you are a specialist in adolescent medicine, which I didn't really even know specifically was a thing, even though I'm a parent and a parent of a teen. But I think it's really awesome that there is this niche that, and you said that there aren't a ton of practitioners who really live in this niche. So I'd love to hear more about that.
Sure. So I am Hina Talib. I'm an adolescent medicine subspecialist and a pediatrician, and I practice here in New York. I'm a teen health advocate. I love educating about teen health, and so I direct our fellowship training program. So I train future doctors to be adolescent medicine doctors here in New York City. And so that's a great question. What is adolescent medicine? Actually, you'd be surprised how many pediatricians ask me that question, let alone parents, because people have not heard of this subspecialty. But within the field of pediatrics, there are many subspecialties like pediatric GI or pediatric pulmonology for the lungs. And so just like that, another subspecialty within pediatrics is called adolescent medicine. So we've done extra training to become sort of like a one-stop shop to take care of teenagers, which means beyond kind of what you regularly learn and get trained in pediatrics, we learn a little bit more about mental health, dermatology, sports medicine, growth, puberty, reproductive health, just to name a few things. And so we end up taking care of teenagers. Sometimes we take care of teenagers just primary care, and sometimes you'll see adolescent medicine docs kind of doing subspecialty care, so taking care of teens who may fit into one of these categories that need a little more help or support in one of these categories. And there are not very many of us. There's less than 500 of us practicing in the country right now. So my passion is also to inspire other people to get interested in adolescent health and work with teenagers.
That's amazing. And I have to shout out, I'm glad your handle is in your little footer thing, but you have a wonderful Instagram account at teenhealthdoc. And I just love the content is so, it's like helpful, affirming, like real. So thank you for what you do there. That's really, really helpful. And we'll link that up so people can just click on over and follow. Well, first, I will say for people who are just joining us, we're having a conversation today about top questions from parents and teens right now related to sexual health and puberty. If you have questions, please drop them in the comments and we can answer them live. Or if you come to this broadcast later, which I know a lot of people do, drop the questions and I'll see if Dr. Hina can get back to them. So let's talk because, and I'm so thrilled that you're here to talk about this stuff because there's so much going on. Obviously, pandemic, and now we've been in it. What's today? We're coming up on 14 months for a lot of people who have been sort of in this different altered universe. And as we know, bodies change rapidly. So talk to me about what you're seeing related to, teens and changing bodies and puberty and questions you're getting and like what's like a way that families can navigate teens through this process of puberty when they'll be seeing friends later and they'll look totally different or, what is happening there?
So puberty does not stop for a pandemic, typically speaking. And it's been a weird year, obviously, for so many reasons. But with puberty and with changing bodies, there's been this sort of on-camera puberty, like when you're virtually connecting through classes or courses or activities, family functions, and then there's been off-camera puberty, and so teens have both had their puberty and changing body reflected to them, like literally reflected to them on a screen in ways that they never had before, and then they've experienced puberty, off-camera, where they may have actually been looking at screens So they've had less time to look at their peers and their peers' changing bodies. And instead, they've had a little bit more time looking at the Instagram look of what a teenager looks like. And so they've had less time with the real bodies and more time with the face-tuned look. And so how confusing is that? Just how confusing is it to have lived in a time where you don't actually get those touch points of what other people's bodies are looking like and how they're changing. And instead you're sort of in this little enclave of having your body change. So what can we do? The most important thing is preparation. And parents are the most trusted resource when it comes to puberty. Sometimes parents think, they'll get it from school, even though it's virtual. They've had these virtual puberty programs in some places, or conversations, or it's in health class, or we assume it's in health class if we don't ask. But preparation goes a long way, and parents have a role to just really talk about it, get out in front of it. And it doesn't have to be this big, huge, deep conversation, but you can start with very little things. Like I noticed, you've gotten taller, or we've had to gap size your shoes. So here are a couple other changes that might be coming. Or have you heard of, or do you know what other changes might be happening? I just want to make sure that I'm here to answer your questions about it.
Yeah, that's wonderful. I'm making a little note to myself here because I want to drop after the broadcast some links to some of our Amaze's puberty videos. Top Signs, Boys Are in Puberty has been like one of our most trafficked videos forever since Amaze launched, because kids and families just need really basic factual information. So, and as a parent of two, including my kids are 10 and 16, I always recommend to parents, keep it short. It doesn't have to be a huge deal. Just like keep talking, always talking. So, and Eden Ponce, she comments, of course, Instagram is totally unrealistic. Yes, totally. I have had people tell me that I actually look like my avatar, and I always take that like as a real compliment. I'm not doing too much crazy stuff. So, it's interesting though. I hadn't thought about face tuning and all of this, the social element, as it might connect to something else that you post a lot about on your Instagram feed. You do a lot of content on eating disorders and body positivity, which I love. And so I'd love to hear what you're hearing from families related to, weight gain. That's maybe not puberty related, but just the changing things that are happening, during the pandemic with body positivity and the sort of pace of eating disorders. What are you seeing happening right now?
Yeah, so, it's interesting in the way that I think other adolescent medicine docs approach changing bodies and weight changes. We want to approach it from a health first and a wellness first and a self-love first place. And then the spectrum of what can go wrong include anywhere from eating disorders to the medical diagnosis of obesity. And so there's this huge spectrum, but what can we do? What can we do is in the middle of that spectrum is the prevention work, which is trying your best to be body positive and to, again, focus on small changes that are specific to wellness. And that, there's so many components of wellness, but it could be on sleep. And that could be the most positive, helpful intervention that you can make. So that's sort of like the zoomed out approach to some of these changes. Of course, you can't neglect puberty. And I think it's important to normalize weight gain in puberty. So many parents, teens will comment or will share that they were called or told that they got pudgy or they gained a few pounds right before they had puberty and they had a growth spurt. And that's totally normal. That's what bodies do. And so I do think that it's important to normalize weight gain and normalize kind of talking about pubertal changes, to take that a little bit off the equation as being, a problem in any way, really. But then, as you said, there also has been more sedentary behaviors, more screen time, less physical activity time. And yes, that has led to weight gain in some young ones. And the way to approach that, again, is to zoom out and not really treat the weight or focus on the weight, but focus on helpful wellness type of improvements. disorders. And pediatricians are like at the ready to help you with this and to be your coaches and to do frequent check-ins if we need to help your adolescents and you as a family make a tiny SMART goal, and then we can check up on it. And I think we actually enjoy being your cheerleader in this process, because it is sort of a long arc process, and it really shouldn't be just about the weight.
Yeah, for sure. I mean, I think it's an understatement to say that there are so many things going on for kids right now. So, I mean, I love the idea of kind of just addressing it sort of, I don't know if I would say holistically or laterally, just in the context of let's go and take a walk together, just and have some time outside. Like it doesn't have to address the thing and make the thing a really big deal. Am I interpreting that correct as advice?
Yes, you absolutely are. I think that when you're talking about teens who do have more weight on them or are approaching the category of overweight or obesity as a medical condition that it is, they already know. They face stigma related to their bodies every part of their day, as they're moving about in their worlds, especially with social interactions with other people, and of course, what I love are parents who are so who create boundaries and safe spaces for their teens and will shoot down when other people start to have that body talk in front of them or body compliments. I love parents who are like, oh, we don't really like, but she also accomplished this year, as opposed to how she looks right now. And so I think that I think those words, that language, that stigma busting is super important.
Yeah, absolutely. I think another thing that often comes up in all manner of work involving communication is just how important it is for us as parents to be modeling, positive self-talk in all kinds of domains. So I think that's probably super relevant here, because I've heard and experienced myself like that a lot has changed, during this pandemic. So we have to kind of be kind. I've been calling it, that it's time for like radical self-acceptance. And so I think that applies all over.
Absolutely. And I think the eating disorder piece, we are actually seeing more eating disorders. And I don't know, and studies are still going to flesh it out. I don't know if it's an absolute increase in the number of eating disorders or they're being recognized more because we are in the homes more and we're picking it up more because we're seeing the eating habits that often get missed, because eating disorders are actually very good at hiding themselves. And so so it may just be that we are picking them up earlier and more, which is actually good, because earlier treatment in adolescence is so important when it comes to eating disorders. But yes, I think that it's a continuum, and just as you said, to sort of lead by example, as you said, that you've been trying to do. It's weird. It's so easy for us to slip into negative talk or complaints about our body or about things, and it takes intention to sort of put like from your lips to speak in a positive way about yourself, and just doing that in front of a teen or a tween is actually really powerful.
Yeah, absolutely. Well, let's move on to one. I'm sort of curious if you're hearing about this topic. It is one of our most popular, and it is porn. So are families talking to you about porn? Again, like the boys in puberty video, our porn videos are always, people are just, they really want to know. And we actually I'll link it up after, but we had a new one that just came out a couple weeks ago. But what are you hearing from families in your practice about porn, especially since there's so much more screen time now?
I get a lot of comments from parents that discovered it or like walked in and saw that there was porn on, or looked at the internet browser or discovered it in some other way. And so I don't know that it's any greater than prior. My gut is saying, from what I'm hearing, I feel like it's been a little bit more. This is not surprising. Porn is everywhere on the internet. And we know that teens spent more time on the internet. And we've asked them to spend a good chunk of their day using remote technology and having multiple windows up and all. And so it's everywhere. And I think Amaze has just honestly the best resources when it comes to talking with your teens about porn, as well as teaching teens about it as well. And this is one of those not to be missed conversations to be had in a pandemic. And maybe we should have a list of those, like these are opportunities that this pandemic has presented to us for not to miss topics to have conversations with teens. And porn is definitely one of them, because I will bet that they have stumbled upon it inadvertently or intentionally. And we give it to them. We just say, you may encounter it because it's everywhere. And so I just wanted to let you know what it is, what it isn't. And that I'm here if you have any uncomfortable feelings and you want to talk, or if it's really awkward to talk to me, your pediatrician or any other trusted adult.
I think that's great. I'm going to put you on the spot. I think you need an Instagram tile with that. Top conversations to have during the pandemic. And also it made me think of one of our educational advisors. He's a health educator named Brad Troger, and he said something, this was years ago, I heard him say this, and it really struck me. And he said that just remember, even when kids ask you about something, it doesn't necessarily mean they're doing it, right? So I think parents can get bound up in, if a kid brings this up, are they watching porn, or are they doing drugs, or are they doing whatever? And sometimes they're just curious and they want to ask you. So I always want to encourage parents to just take a breath, try to remain calm, and remember that the point is to just try to answer their question honestly. And also, if you don't really know the answer to the question, look it up, contact a pediatrician, whatever, the realm may be. It's just really important to kind of keep, I feel like, to not freak out, I guess.
Yeah, taking that breath in before you respond, and not contorting your face before you respond is so not clenching. It's because they can read your body language pretty well. They live with you. They know you, and so they're really good authenticity detectors. Teens are just naturals at that. So you really do want to try and have the most open response to when they have a question. I mean, honestly, the flip is what I hear more, which is a parent asking me, you're telling me to have these talks. I'm worried that having these talks will then inspire them to go do X, Y, or Z. And I get that as a pediatrician and an adolescent medicine doc. I get that too, where parents are like, are you really going to ask, what are you really doing when you have private time with my teen in the office or the virtual session? And are you putting ideas in their head, or are you sharing information that's going to then make them do X, Y, or Z? And so I think the flip is important too, to realize, we've done studies on different health behavior topics, and we know that it doesn't actually inspire, giving them health information doesn't inspire them to then go do X, Y, or Z. And so it empowers them. And so that's important to remember too.
Oh, that's so important. Well, I just want to encourage people, if you're just joining the broadcast, or if you come to this later, I have a couple more questions for you, Hina. But if you have a question, we have a teen expert on the line right now. So drop us a question in the comments. But otherwise, I'll just keep asking. So obviously, right now has been really difficult in the realm of relationships and friendships. Friendships, yes, at a baseline, but even romantic relationships, when there was basically 6 feet rules, all that stuff. So what are the top sort of concerns that you've been hearing from families about relationships? And, what would you say a top line recommendation or two would be for teens who are trying to navigate their way back to, seeing people and spending time together?
Yes, this has been a weird time for friendships, but as well as romantic relationships or crushes, which are developmentally totally normal for this, the age group that is tweens and teens. And so there has been some heartbreak. There have been some disconnected relationships. I've had parents just say they're so torn up about this a relationship that didn't continue because of the disconnection from the pandemic. So I was hearing more of that early on. And now what I'm hearing more is dating and opening up, because we are in many communities. Teens are opening up more. In-person proms are being planned with, as much mitigation measures as possible outdoors, masking, people are pulling it together to make that event happen this year in a way that didn't happen last year. And so I think that again, this is one of those hot times to have the conversation about healthy relationships and dating, because it is something that was closed down and is opening up more. And and I've had other adolescents and other young adults and other families who created entire pods around their teen significant other, because that's the choice that was made, because it was a close relationship and you wanted to honor that. It was helpful for their well-being. And so it's really been a range of what people have kind of experienced when it comes to dating through the year. I had a parent say, "Oh, but none of these kids are sexually active this year because of the pandemic." And I was like, "Oh, that's not what I'm seeing." We are still talking and testing and doing all the reproductive health care counseling that we used to before. And so it's interesting. So I would say there's definitely a range, but this is a great time to talk about healthy relationships and what that means. And then I will say, to put it in terms of COVID and opening up, there's a really interesting parallel between consent when it comes to how we have conversations with COVID safety. So, I'd like to, if you take a date, for example, I'd like to, go on this date or do this activity with you, but you have to make sure that the other person feels safe when it comes to COVID precautions. So are we going to do this activity indoors or outdoors? Are we going to do this activity masked or not masked? Have you been vaccinated? So there's a parallels with that and consent for sexual activity. So a little bit wonky maybe for people, but I think of it as a skill that can be applied in both ways, where you're teaching the art of having an open conversation around what you feel comfortable with. And making sure you hear that emphatic, yes, I am comfortable with this step, and before you proceed. And if not, here's an alternative that we can do, no worries, so to have, here's how we can accommodate each other's sort of boundaries or safety measures. And so
I think that is super genius. And the other thing I love about it is that it's a conversation that a parent can have with their kid where they're also experiencing the same thing, because certainly I have found as an adult, this pandemic has definitely made me like a little more anxious, a little less trusting, just of humans. And so, we're all experiencing this level of sort of consent and figuring out what the boundaries are in real time, all of us. So I think I love that it's not just saying, oh yeah, back when I was young. It's actually saying, yeah, right now, this is what my experience is, which I think is really valuable.
Great. And that art of sort of negotiating and having those open conversations with your friends, and then we modeling it too with our friends, trying to figure out how we are going to open up, depending on what's going on in our bubbles and what precautions that we're taking as a family and things like that.
Yeah. It occurs to me hearing you speak that I have one sort of flip side question to this relationship situation, because while there are certainly kids who are going to be ready to just like rush back into all the things that are happening, also there's a lot more anxiety probably, and a lot of like social awkwardness and difficulty with that, and fear of kind of re-entering the fray. So, have you seen an uptick or just people talking about the anxiety side of it? And what would be, a top recommendation from you for a family has a tween or teen that is really nervous about getting back into social situations?
Yeah, so whether it's health anxiety, which again, many people are feeling right now, or feeling from COVID, then from this vaccine or not, and then from social interactions. So whether it's health anxiety or whether it's true social anxiety, which is, a diagnosable disorder, or something, or something on like just the feelings of having anxious feelings when you're encountering other people. I think the biggest tip I can say is we don't want to create too many accommodations or pathways around these feelings. We do want to say, I can understand you feeling that way. I feel that way a little bit too. It makes total sense that you would feel that way. So validating this uncomfortable feeling, like you always want to start off with validating and just giving it to them. let's try this, or how about we try this, or I can practice this with you. And it can be as simple as like a trip to the grocery store, or meeting a friend, having them both be outside. So play dates for younger people and meetups for our teens and tweens or young adults. But facilitating them, giving them kind of pathways to practice, to get over, or not, I shouldn't say get over, to build a tolerance to these uncomfortable feelings is the way to deal with all anxiety. But in this particular situation, if you can come up with a couple of activities in kind of grades of how exposed or uncomfortable your teen feels, and then just try to get these activities, try to help facilitate them, that will be very, very helpful. I know, many teens have gone back to in-person school, but not all. There are parts of our country where teens have still not, gone back to in-person school. They may be considering in-person camps, or the fall may look different. And so we're going to have these waves of these feelings that you're talking about in different parts of the country. And so validate, don't accommodate.
Yeah, that's super smart. Let's see. We have a question here. I just have to try to get it on a bigger screen. Hang on one second. Okay, so the question is, I feel terrible that my teen, a high school junior, hasn't even had a chance to develop any crushes because she hasn't been able to hang out with more than about 4 of her friends. A bit nervous about things opening up, becoming more normal due to potential COVID exposure. Because she starts hanging out with kids who may or may not be following similar safety protocols that we've asked her to follow. So what might be some language you'd suggest to use that she could actually feel like she could use with her new friends, like without sounding like she's carrying a script from her parents? Does that make sense?
Yeah. I think that's a great question. Sometimes teens like to be able to put it on their family because it's an excuse, or it's sort of putting it off of, this is coming from me. And so other teens really want to own what they're saying. It sort of depends on where they are in development in terms of, this is what I feel is what I want to do for my own safety. So depending on where they are, I don't think it's the worst thing to say, well, my family's pandemic rules are, or my family's pandemic plan or safety plan this month, because we all know it changes month to month, is X, Y, or Z. And it's, and you don't have to, you don't have to, as a teen, explain, and I think we, even as adults, we don't have to explain our specifics of why our families or our pods rules are the way they are. We feel like we have to, right? And so tell a teen, you don't have to. You would just say, this is what my family is doing this month for our safety. And if people, if it's a close friend and they're asking you, that you can go into why, we have an older person who we see, like a grandparent, or we have an immunocompromised person, or we have a young kid who we're worried about, or whatever, or we're planning a trip in 2 weeks and where we're hunkering down for the 2 weeks before so nothing messes that up. I mean, there are a lot of pragmatic reasons why the plan can be in flux. And so I think that it really depends on where your teen's maturity is and how much, but I would empower them to not feel like they have to over-explain and to just say, these are the rules this month. And that it is what it is, and that's my personal business, to be honest. But you'll have other teens who maybe they have rules that are different than their parents. And so that's, we also want to empower and listen and encourage their own thought processes about their safety rules for themselves. And sometimes they're not going to be copacetic with ours. And we may, as parents, have to interject and say, I hear you, why your safety rules at this moment are this, but we also have to do this. This is why. So it's a conversation. It's tricky. The language that I would ask teens to use, really to empower them to be able to tell others that this is my choice. Or if they don't feel like saying that, this is my family's choice, and it is what it is. It's what the plan is for the month.
Yeah, I like the idea of keeping it just super simple and cut and dry like that. And, I'll also slide in here because empathy is my jam, or my life mission to help people with. But I think that one thing for sure is that this pandemic has opened a window to have conversations about empathy. If you have, in our household, we have one small person who is not vaccine eligible yet. We have to continue to make decisions that will, and for a long time, we were taking care of my mom. And so, we've had to make a lot of decisions and opt out of various things in order to keep other people safe. So I think that's always, and it doesn't need to be heavy-handed, but I think it's just always, anytime you have a little opportunity to touch on empathy, I'm a huge fan. So.
That's so important. It can't be understated, the empathy part of this. And I do think that teens, again, I just think teens are amazing, but I think teens naturally have that spirit of wanting to save the world. And so if we can dig into it and let them lead, like it's amazing. Again, I think it could be amazing. So if they have that within them and they want to lead with that and say, well, this is important for me, for my community, for my country, for my, school community, they, by all means, let them be voices and advocates.
I love that. Oh, I love that so much. All right. Well, I know you have a busy schedule. I have one more question for you. It's kind of a big one, but I'm just curious. And we here are very pro-science. We are in such a time of transition, and like this is all happening in real time. We've got a vaccine rolling out. There is hope for, reduced age limits on the vaccine. What are you hearing, if anything, from families about concerns related to like the intersection of the vaccines and puberty and just like development in general? Is that an issue that's coming up for people?
Yeah, I've had, so I share vaccine information in real time as we're getting it in my stories frequently because it's been in the news a lot and we've had some developments, as in we're expecting a big development later today. But the questions that I'm getting are so very thoughtful from parents, and a big one has been about puberty. And that's a topic for today. And so, we'd be remiss not to mention it, but parents are asking, is this vaccine contraindicated, not as efficacious, or somehow harmful because my teen is going through puberty? Mm-hmm. Their body is changing. They are potentially gaining mass, gaining weight as a normal part of puberty. They have hormones that are kind of in flux. And so are any of those things reasons why this particular vaccine you would have pause or give a second thought? So I think it's just a terrific question. And the answer is not really. Immunogenicity from a vaccine doesn't really get impacted by puberty. And we know this from other vaccines. So there are a slate of vaccines that we recommend in adolescent ages. And we never, hold one of those back depending on what pubertal stage you're in. Mm-hmm. And then I will just say, what the information that we have so far is from press releases from Pfizer and Moderna. But very soon we're going to have a much more, I think, thorough vetting of the data that they're presenting by the FDA, then by the CDC, and the American Academy of Pediatrics will weigh in on it. And so I think we're going to learn a lot more this week about this vaccine. But regardless of those processes, which are very important and will be likely happening this week, I can still say with full confidence that there's no reason to worry that an immune response, the immunogenicity of a vaccine, would be markedly harmful or different in a teen that's going through puberty in the 12 to 15 year age range. But again, a really, really good, thoughtful question.
Oh, that's fantastic news. And I didn't realize we were getting so close to having like other news this week. So that's very exciting.
We are.
Yeah, that's incredible. This has just been such a great conversation, Hina. I'm so appreciative to you. Is there anything else that you want us to know, like anything top of mind before we close out today?
I think just don't underestimate how valuable your voice in the home is, for positive and negative. I think that I hear, I spend a lot of time with teens confidentially in my office, and I hear a lot of what happens. And sometimes we say, kids are barometers of what's going on in the home. And I don't say that in a way that makes you feel worse right now, because I'm a parent too, and I've struggled a lot this year. But at the same time, just to put in the back of your head, your voice matters, your actions matter. The tone matters, your body language matters. They're sponges, and even if their eyes are rolling. In fact, if their eyes are rolling, they're probably paying more attention.
What a positive flip on that. I love that. I'm gonna get serious ROI. I love it. Well, Dr. Talib, thank you so much. If you are coming to this broadcast later, please drop a comment if you have one, or an emoji, or whatever, high five. This has been amazing. And of course, you can access this on replay anytime. Dr. Talib, thank you so much for being with us. This was just such a valuable conversation, and I love talking to you.
Me too. Thank you for having me. Honestly, the resources that Amaze has are my absolute favorite to refer parents to. They're free, they're high quality. So thank you for the work that the foundation does and puts out. I think that's invaluable.
Oh, that's amazing. Thanks so much, and take care, everybody.